ji. Very warm welcome to all our panelists, both from industry, respected members of the industries. I see many of you are technocrats, and so that brings great value to the discussion that we are going to have today. And also to all my colleagues in the central government and in the state government. It is good to see familiar faces, but I do hope that the discussion we will have will take us into unfamiliar territory, because that is the idea, to challenge ourselves to think of innovative ways of taking this very successful industry to the next level. I will just try to highlight 3 or 4 issues which I believe may be useful for the scale. As you know, the government has now announced the Atmanirbhar Bharat strategy, which is Make in India, Make for the World, but it focuses on achieving scale. And if I look at the pharma companies in India, we have, of course, the large companies, many of which are represented here. We also have a large number of MSMEs spread over several clusters, which also bring great value to the sector. But if you look at the global picture, 8 Indian companies are in the top 100 pharma companies globally. Now, this is a matter of pride, because there may be very few sectors in which we can say that, 8 or 10 of Indian companies are in the top 100. It may not be the case for many sectors, but in pharma it is true, and that's a matter of pride. If you dig a little deeper, which I did, I find that the largest Indian company, and I'm not going to name names here, because the largest Indian company in size is about $4 billion. I'm talking about 2019 figures that I have, and please correct me if I'm wrong. Whereas the largest global pharma player is $82 billion. So you can see that the gap between the top Indian player and the top global player is still significant. As part of this ambition to reach a size of 130 billion and continue our export thrust, I think we will have to talk about how we can increase scale. So that is one, scale of manufacturing. How are we going to get there? The second issue I would like to highlight is whether we should be doing more of the same, or we should be doing more and different. This is again a challenge I would request all of you to address, because right now the strength of the pharma sector in India is in the generics space, and the export also is largely dominated by the generics. Are we going to grow only in the generic space, which I would call more of the same as a growth strategy, or are we going to do more and different? What will more and different look like? How do we gear up our manufacturing capabilities to do more and different, if that is what we want to do? If all of you collectively feel we should just be doing more generics and ramp up in scale, that is also an option. But I think the world changing the way it is, product diversification, market diversification are important. Third point I wanted to make is that we are very well known for our cost-effective products. We are very well known for it. We also have very strong quality controls, and we have Dr. Somani Saib here who makes sure that the sector stays true to quality. I do feel that maybe there is a possibility, as we scale up in size, as we go for more and different, that quality will have to be watched very carefully. What is it that will be required from the industry, from the quality regulating authorities, etc., in terms of technology upgradation, technology support, testing the capabilities, testing infrastructure, test and trace, tracking mechanisms, manpower? We have Dr. Kiran Kalia here from Director NIPER. So she will be happy to listen to you on what is your expectation in terms of manpower for the sector that can give you assured quality. So this is the third thing that I would be very happy to hear your views. And the last one I would talk about is the general ecosystem. Yes, all of us, we are the beneficiaries of the trust that the Honorable Prime Minister has given over the last 6 years for ease of doing business. We have state governments here. I see Himachal Pradesh, I see Maharashtra, I see my own Gujarat, and the state governments are doing a lot to support the ecosystem, putting up parks, putting up, logistics infrastructure, supporting through incentives. They are trying to create that ecosystem, right? We also are supporting the industry by saying, okay, the missing gap of API is now under our radar, and we are trying to ensure that the industry comes back to its strength in API. What are the elements of the ecosystem that you think would be critical for strengthening the base both in the domestic and the global markets in the manufacturing and supply chain? Before I end my opening remarks, and I hope I've not been too long, Ashi, is that we have to also remember that we are doing all this within a space that is heavily regulated, because the products are a part of a global public good. So we are not, making Coca-Cola or beverages or automobiles or something. We are making products that are necessary for the quality of human life, which contribute to the SDGs, which contribute to the Human Development Index. So within that perspective, how do you feel that we can, as a country, um, make sure that we are able to strengthen the manufacturing base, particularly at a time when globally everybody is looking at diversifying their supply chain? Nobody wants to be excessively dependent on one source of supplies, and you have seen the risk to that in the last calendar year in 2030. So there is an opportunity, there is a challenge, and I would be delighted to hear all your views on this. Thank you, Ashit, for your opening, and Sudarshan ji for your opening. Thank you. Points that I have noted down very, very quickly, because I'm already at 11:41. One is, infrastructure in the form of parks. Yes, Government of India has a scheme. The selection is not yet done, but states are free to go ahead and do their own parks, right? We are not going to be setting up parks in every one of the 32 jurisdictions. So I think it's for states to recognize the opportunity, take it forward, while Government of India will, of course, be supportive when the time comes. Second, there was a lot of talk about digitization in the beginning of this 1.5 hours. Many of the industry colleagues talked about it. I would like to ask you to take this ahead in terms of automation of manufacturing, use of AI, for example, in manufacturing, quality control, etc. That is also going to be important. Not only digitization in inventory management and supply chain management. Third point, we had a very fairly successful PLI, but it is true that out of 41 APIs, we could not get applications for 7 of them. Perhaps some kind of introspection is required, what we can do for the others too. Of course, APIs will also be included in the new PLI. I'm happy to share with you that new PLI can also look at KSM if you think that is important, and it is a critical gap that Dr. Somani just mentioned. So I will have a look at that too. I would also like to just share 2 points on PLI. One, when we look at the applications, there is great variation in price and investment levels for the same product for the same volume. I'm unable to understand why this is, and we were also put to some challenge to explain it to the empowered committee. I request industry to also look at these issues and see that the applications that come in, the parameters that are being posed, have a sense of rationality which will build both credibility as well as ease in the processing. And lastly, in PLI, you may be aware that Atmanirbhar strategy consists of 3 prongs. One is PLI, second is phased manufacturing program. Some of you said, I think Aurobindo said, that you will continue to need support even as you ramp up manufacturing. There is a phased manufacturing program for it. We have recently released a notification in terms of, I think, dialyzers or X-ray machines or something, where over a period of time we will raise the import structure. But we have to be confident that domestic production will increase. Otherwise, health sector will be impacted. And in PLI only, Atmanirbhar, the third is FTAs, which Dinesh ji measured. mentioned, right? So the Atmanirbhar strategy is not only PLI, it's PLI plus TNP plus FTA. All of us should keep it in mind as a sector. We should be able to take benefit of all three prongs. Export challenges were mentioned. You mentioned that we should work with the EOIs. I think we should. Pharma industry and sector should try to create specific strategy for specific geographies that we are targeting. Pharmexil data shows us that India meets 50% of the domestic demand in Africa, 50% of the domestic demand. This is a growing market. Are we targeting it, or are we still, running after the euros and dollars? This is something which I feel is an issue for the whole sector to look at. Because why are we talking about it in manufacturing and supply chain? We are talking about it is because export improves the efficiency of the domestic industry, because export is more challenging and it will make you more competitive. Then I come to good manufacturing practices and PIC. I'm glad to hear a lot of voices in favor of joining with PIC. I think we need a industry-wide consensus on this. PIC is not something to be afraid of. It is something to be welcomed because it will reduce the compliance burden, multiple inspections for our smaller units. So smaller units should also realize, the MSMEs should also realize the importance of PIC. But I think that is an ongoing conversation. I see Mahesh Doshi Sahib sitting up here, kya ho raha hai? It's an ongoing conversation. We have to work our way through it. Then I come to promote brand India. Yes, I agree with you. That is why I said let us work with the embassies. But for that, you need a country-wise or jurisdiction-wise strategy. Finally, Kiranji mentioned skill. We are now amending the NIPER Act to allow NIPERs to offer online courses, executive courses for the existing manpower. We would be very happy to have industry academia linkage in this. We will also be happy to have industry academia linkage in research. Please pose your problems to NIPERs, challenge them, because we are spending so much money on NIPERs. We are spending some 200 to 300 crore every year. We would like the industry to take maximum benefit of NIPER. And finally, I heard you, Udayji, on R&D incentive. We have a special session on R&D. We have an R&D innovation policy coming out. I don't know whether the tax incentive will come back very soon, but some of the industry members have suggested other form of incentivizing. As we have production linked incentive, they have suggested other forms of incentivizing also. We will be very happy to look at. In the interest of time, I'm not going to pontificate too much. Just to say that thank you for all your inputs. Thank you for spending the time with us. These are very valuable sessions which inform our strategy and policies going forward. So thank you very much to each one of you for your time. Thank you so much.